Today I'm going to be talking to you guys about panoramic imaging. Panoramic imaging is an extraoral technique that captures an overall view of the maxilla and the mandible. It can be difficult to achieve as there's many factors that can cause an undiagnostic image. I'm going to be giving you guys a quick overview of tips and just to help refresh your guys' memory. So, first of all, a panoramic image can show us a large amount of information of the dentition and supporting structures. We can see impacted teeth, lesions, trauma, and detect further diseases. Second, I just want to note that the receptor in the x-ray head is what's rotating around the patient. So this and this will be rotating around your patient. Third, as an assistant, we always need to be thinking ahead. We need to be anticipating what we're going to be doing next for our patient. So preparing our equipment ahead of time can save us a lot of time. For quick and ease of use, you can do this prior to the patient's appointment if you can. Make sure your equipment is sanitized and you're following proper infection control procedures. Place your barriers and always protect your bite stick. You might have disposable ones or you could have reusable ones. Have them ready to go in your room. You can also, if you can kind of gauge the height of your patient, you can adjust the setting prior to, but that's not always necessary. Fourth, always make sure your patient preparation is done correctly. Therefore, no jewelry, earrings, no tongue rings, just to avoid ghost imaging. Simply make sure your patient has a brief rundown of what the panoramic machine is going to do. If you guys remember, we did do a competency on the pano machine and on patient education. So if you can recall how to explain to your patient what they're going to do, it will help them create a better image. Always apply your lead apron. And remember, you don't want your lead apron too high on the cervical spine or else you will have that ghost image there and we won't get this part of on the pano image. So the most critical step is patient positioning. This is where most of the errors will occur on your guys' images. Make sure your patient is always standing tall. The spine needs to be perfectly straight, shoulders back. Simply have them walk up to the pano machine, place their hands on the handles, and then have them shuffle their feet right underneath them while maintaining good posture. Patient positioning is critical on the pano machine because we will be lining further lasers, like the Frankfurt line and the mid-sagittal line, and this can be adjusted. The focal trough is important to be accurate within the panoramic image because it determines where the dental arches must be positioned just to capture the sharpest image. Here is our mid-sagittal plane. That's going to be going straight down their face. And then we will also be adjusting the Frankfurt plane. This is going to go right here on the ear and then right under the eye socket. So the mid-sagittal plane divides the body into left and right equal halves, and your Frankfurt plane will be going right under that eye socket and right here on the ear. And like I said, those two lines are very important in setting up the focal trough. When you're ready to take the x-ray, remember to have the patient swallow to get rid of any air gaps in the mouth because that can appear on their image. You can always have them close their eyes if that's helpful and hold for roughly 20 seconds. But if you want a quick tip, tell your patient the time is longer, like 30 seconds, so that 20 seconds goes by a lot faster. So a diagnostic panel will show accurate representation of the dental anatomy. If any distortion occurs, it is important to be able to what caused your error. So, for example, if we have an exaggerated smile line, such as this, also known as the jack-o'-lantern smile, this is going to mean that the head was tipped down too much. So the teeth are not accurate, they are distorted, it's not a very good image. If you have blurriness, like in this image here, that means you had some patient movement and you're gonna have to retake it because obviously you can see you can't see the dentition very well. It's undiagnostic. But most of these errors are gonna deal with your chin tilt. like I said, on this jack-o'-lantern smile. So I hope my video helps you guys refresh your memory on panoramic imaging.